Hi, guys. Hey, today we are going to go over a few details about how to do a patient assessment for our gynecological emergency patients. So, to start off with, I'm just going to very simply tell you that there are a few big reasons that females will have vaginal bleeding, which is the one thing that we are, well, not the one thing, but one of the big things that we're looking for in an emergency. Obviously, blood loss is a big deal. It can be a big deal if there's too much of it, and depending on the reason that a female is losing blood vaginally. So, some of those reasons that a woman is going to be losing blood vaginally are that she's having an abnormal menstrual period, that there is some kind of vaginal trauma, either externally or internally, that she could be experiencing an ectopic pregnancy. There could be a spontaneous abortion taking place. There could be different kinds of diseases also uh, that could be happening, causing that. And so to jump right into the patient assessment, what we're going to do, the very first thing that we do as EMTs is we do a scene size up. And first thing we do is, what do we say we have on our BSI? And the scene appears to be safe, right? Not always the case as far as scene safety, but we always want to have our BSI on or PPE. And and what that's going to look like for a gynecological emergency, because there tends to be blood loss and a lot of blood involved. We need to make sure that we really don't just have on our gloves. Okay, we need to also make sure that we are gowned up, that we possibly, you might want to think about wearing a mask. Just be aware that you could very easily be exposed. So make sure that you're protected that way. And you do want to look at scene safety, just like with every other call that we ever go on. We're going to take whatever dispatch tells us into consideration, and they hopefully have the right information and they'll be able to tell you, we hope. And if they can't, we're still going to be assessing for ourselves when we arrive on scene there. Is the scene safe? Is this an assault? Is there any kind of crime that's going on here? Scene safety could also just be the fact that there's body fluid, but make sure that you're safe. And if there is any kind of scene safety issue for you, because a lot of times in a vaginal bleeding situation, there could be some kind of assault that's taken place there. So if that's the case, or if we suspect that once we get onto the scene, you need to make sure that you get the police involved and that you have the right people there to protect yourself and to protect your patient. So um, call for backup if you need that. And if you, as an EMT level provider, if you feel that this patient might need IV access, which they very likely will, if they're calling 911 for some reason, then you need to call for ALS, okay, and get your advanced EMTs and your paramedics there. uh, so the next thing that we're going to do is we're going to form a general impression as we're walking into that scene and we're looking at the patient. We're physically seeing the patient, we're seeing the scene, we're looking at everything around us and around the patient. How does that patient look? How are they responding to you? Do they seem like they are alert and oriented? Do they seem like they're kind of out of it? Are they making eye contact with you? What does their color look like? How are they breathing? Does it look like everything's adequate, like they're pretty with it and everything seems to be okay? Maybe this isn't a really big emergency, or could this potentially be something life-threatening that you really need to step up your A game and jump in there and really take care of that patient and be aggressive about your care? So we're going to look at all of that. And when we look at skin CTC, we're checking their pulse, right? Because we want to know, um, well, after we check and assess their breathing, are they breathing too fast? Are they breathing too slow? Is it shallow? Is it perfect? What does that look like? And obviously, if their respiratory rate has increased, and hopefully you've gotten there before it starts to decrease too much, but we know that their body's compensating, right? And then we're going to check their heart rate, and if the heart rate has increased, then we also know that their body's compensating, right? The respiratory system kicks in when it's trying to get more oxygen into the body. the heart rate is going to increase when the circulatory system is saying, okay, we need to pump that oxygen around because obviously there's not enough of it. Maybe they've lost too much blood and there is not enough red blood cells left in the body to carry adequate oxygen supply. So the heart starts to beat a little bit faster, or sometimes a lot faster. So we're going to look at all of those things. And then we look at their skin CTC. If your patient is pale, cool, clammy, we can look at that by pulling your glove back, right? Or actually using your glove and feeling the forehead, checking, are they cool, clammy, and also you can look at their nail beds if they're not wearing nail polish, right? You can look here at the mucous membranes, either in the mouth, in the eyes, all those different areas that you know of. And we're just going to look at that. If they are pale, cool, and clammy, then we know that they're showing signs and symptoms of shock, which is hypoperfusion, which means that they do not have enough oxygen in their body. That's when we need to recognize that and consider putting on oxygen to our patient, delivering that medication to the patient. And so if it's not terribly bad, we can just give them a couple of liters, maybe by nasal cannula, all the way up to they may need 15 liters of oxygen, right, by non-rebreather mask. So we have to look at that and figure out how much our patient actually needs. So we're going to do some history taking next, and we're going to ask all of the OPQRST questions and our sample questions. So you know what they are, but we're going to ask about what was the onset of this? How long has this been going on, right? When did this start? Did this vaginal bleeding start today? Or has this been going on for 4 weeks? There could be a big difference there in the outcome of your patient, depending on how long and how much blood loss they have actually endured. So, and then what is the quality also? What does this feel like? Do they have abdominal pain that's associated with this? Do they have vaginal pain? What else is going on that you can find out about what it feels like? And if there is any kind of pain or sensation, does that radiate anywhere? And is there anything that makes it feel better or worse, right? Have they maybe taken some type of painkiller to help them with that? Have they put any hot compresses on their abdomen to help them to maybe relieve some pain? So we want to find out about that too. Also, are there any other signs and symptoms that they might have had? Like maybe they have felt dizzy or lightheaded, or maybe they've had a syncopal episode where they have actually passed out. So we want to find out about those kinds of things too. And are they allergic to anything? Is there any kind of medication that they are normally taking? Like maybe they're taking birth control. Those are the kinds of things that might be related to a gynecology patient that we want to know about. And when was their last menstrual period? And not only when was their last menstrual period, but when was their last normal menstrual period? You might want to know the answer to that question too. And these can be sensitive questions that you're asking. Obviously, this can be a sensitive topic for a lot of people. So, just be aware of that and how you're talking to your patient, and make sure that you're being very respectful to them while you're having this discussion with your patient. But you also need to ask about STDs or STIs. Do they have any kind of sexually transmitted disease or infection that you should know about? And obviously, if they do, you probably need to know about that. Okay. When was the last time that they had anything to eat or drink, and what were the events that were leading up to this? Did this just spontaneously happen? They just spontaneously started bleeding, or having lower abdominal quadrant pain, anything that could be associated with female reproductive organs. What did they fall, right? Could they possibly be pregnant? Was there some kind of an assault that took place? And so you need to find out what was it, you think that maybe brought all of this gynecology emergency situation on that caused them to call 911 for you to show up and take care of them. So try to get to the bottom of that. Then we want to make sure that as we do our secondary assessment that we're taking their vital signs and look at their blood pressure, look at their heart rate again, their respiratory rate, their skin CTC again. We're going to check all of that again. Check their pupils, find out how their brain function is working, check their blood pressure, make sure that that is within normal. And then we're going to treat anything that we find that is not normal, right? We look at the signs and symptoms, we look at the vital signs, and then we look at that as a whole. We don't just say, oh, they're breathing kind of fast, so obviously they're a very sick patient. No, we have to take all of the vital signs, we ask all of the questions, we act as a very good detective, and we try to figure out what's actually going on here, and we treat the things that are outside of a normal range. Okay, so that's what we're trying to do here. And you can also take orthostatic vital signs, and if you don't remember what that is, orthostatic vital signs basically start off with your patient laying down, in a laying down position where their body is able to function very well, should be able to function very well laying down. It's not under a lot of stress. We're going to take vital signs that way. And then depending on who you learn from and what your where you learned this from, about 5 minutes later, you're going to have your patient sit up. Instead of being in a laying down position, you're going to have them sit up. And you're going to take those vital signs again. And specifically, we're looking at blood pressure to find out, well, and respiratory and your heart rate. We're looking at those to see, as the body sits up and there's a little bit more stress put on the body, can the body handle the fact that they're in a different position now, and it's having to function a little bit. It's just having to deal with more stress in a sitting up position. So you take those vital signs again, and then about 5 minutes later, you take the vital signs again while the patient is standing up this time, figuring out, can the circulatory system and the respiratory system handle the stress of the patient actually standing up? So are they, and it kind of tells you whether or not your patient's in shock. That's kind of the bottom line there. We're going to assess the abdomen. This can be a mechanism of injury, and it can also be a nature of illness, depending on what brought this on. Even if this is a nature of illness, we're going to assess the abdomen. So you're going to palpate the quadrants, ask the patient first if they've got any kind of pain, any kind of sensation there, and then we'll assess that abdomen and find out, does it feel distended? Is it swollen? Is it rigid? Is it soft? Is it normal? And talk to your patient about that and ask them to describe what it is that they're feeling and experiencing while you're doing that assessment. And then genitourinary. There are times when we need to look at genitalia to determine if there's anything else that we can see, or if there's more information that we can gather. So we need to assess how much blood loss there is, and you can do that by asking questions. How much blood do you think that you've lost? How many sanitary pads have you soaked through so far? And they may or may not be able to tell you the answer to that, but you have to become very good at estimating that. And when we go into the OB lecture, I'll do a little a lesson where I show you kind of how to figure that out. Maybe you guys can practice that at home, figuring out during OB. Then I'll show you how to do that, and we'll play a little bit with that. But you need to become good at estimating blood loss. But you may need to look, and when you look at that genitalia area, assess maybe how quickly they're bleeding, how much blood loss is there, and also if there's any kind of trauma, if you know, or if the patient tells you, or you have any kind of inclination that there is possible trauma there, you need to be very, very careful about the way that you're interacting with your patient, and make sure that they know and that they feel comfortable enough and safe with you to allow you to do that. Some people are going to be very hesitant and not want to allow you to do what you need to do. And so you need to make sure that you have witnesses there, right? We always have to protect ourselves and protect the patient, and make sure that we've got all of the bases covered, okay? But if there is any reason to believe that there's any kind of trauma, then you will need to look and see what's going on there. And then neurologically, we're going to assess their mental status and find out, are they alert and oriented times 4? What's their Glasgow Coma scale findings? And then when we do get into our physical exam of the patient, you need to make sure that you remember that as far as female genitalia goes, everything that we do is going to be external, okay? As far as EMS is concerned, at the EMT level, everything is external. So you're going to look, there's really not a lot that you need to be prepared to do other than possibly control bleeding and administer high flow oxygen, position your patient, cover them up, keep them warm, and transport and call for ALS because you probably will need IV access and transport. And the rest of the physical findings, for the most part, are going to be done by other professionals once you get to the hospital. So only look at that genitalia and examine it if it's necessary. And when there is vaginal bleeding, if it's caused by trauma and there is any kind of external bleeding, we control bleeding just the same way that we do any other kind of bleeding. We apply pressure. So we can use a sanitary pad and we can cover that external genitalia and apply pressure there. If that's what we need to do, then we need to stop bleeding that way. If it's internal bleeding, where that vaginal bleeding is coming from, we can still cover that area with a sanitary pad, and we transport and we can treat for shock, and we can get those large bore IVs started by ALS that you've called in for backup to help you. But there isn't anything internal that you as an EMT are going to do for that patient. So other than everything we've talked about, and transport as a high priority patient. You can also look for any kind of vaginal discharge, whether or not there's any trauma. But typically, if it's an NOI, a nature of illness, then we're going to look for any discharge. That might tell you that the patient may have some kind of an infection. There could be a disease, some kind of illness going on there. So, and then we're also going to look for syncope. What is that? Syncope is just if your patient's feeling dizzy, if they've actually passed out. Do they have a fever, meaning that their body's trying to fight off some kind of infection? Are they nauseous? Are they vomiting? Is there any other kind of gynecological history that they might have? And they may be able to tell you that they've got some kind of ovarian cysts, or they have, there's all kinds of different things that can happen with female anatomy. So just ask them if there's anything else that they need to know about their gynecology history that's going to help you out, okay? As you you do your reassessment, then we're going to go through everything. We're going to start at the top and we're going to ask questions again. Ask that patient, is there anything that we've missed? If there's any extra questions that you need to know, like, you know, is it possible that you could be pregnant? And many patients will say, no, that's not possible. Okay, well, are you sexually active? Oh, no, not me. I'm not sexually active. Okay, well, so you're not sexually active right now. When was the last time that you did have intercourse? Oh, well, that was last week, but I'm not sexually active right now. We get all kinds of answers from people, and we really do have to be a good detective and figure out, is it possible that they could be pregnant at all? Okay. And if there's any possibility, we can also take into our mind that it could be an ectopic pregnancy. If they have any kind of lower abdominal quadrant pain, uh, especially anything that's come on with sharp pain, could be pretty sudden or maybe come on gradually over the last couple of days, and it's just getting worse and worse. We need to, assume that that's a possibility that could be going on, and that can be life-threatening. That could cause the loss of life for the mother and potentially a fetus that she might be carrying. So, so just pay attention to that. And then we want to make sure that we are relaying all of the pertinent information to medical control and to any ALS units that we've contacted and asked them to come on scene to help us out. Make sure that you're documenting everything that you can and really listen to your patient. So we want to keep their privacy intact as much as possible. And one thing that you need to remember to do with patients with these kinds of emergencies, I mean, everyone really, but some things are more personal and private and tend to cause more trauma to our patients than others, and this is one of those. So if there are any extra people on the scene that don't need to be there, you probably want to get rid of them. And you may ask them to leave. You can have your partner take them, off to the side to ask questions to help fill out your report. Paperwork, you can always have, ask your officers to assist you with that. And if your patient seems to be afraid or they're constantly looking at another person before they ever answer your questions to kind of like check in, like get a feel for, is it okay for me to say something here? What is okay? What isn't okay? Just be very aware of that. Be very mindful of how your patient is acting, but protect their privacy. Keep them covered as much as you possibly can. Try not to expose them unless you absolutely need to. And remember that external genitalia, male and female external genitalia, can be very sensitive when there's any kind of damage there. So any kind of laceration, any abrasion, anything like that is probably going to cause a lot of pain. There's a lot of nerve endings there, and there can be a lot of blood loss, just like the head. If there's a head wound, there can be a lot of blood loss that takes place there. Same thing with genitalia. And so know that there might be a lot of blood loss, but the cause of the blood loss, if it's external, may not actually be that bad. So you really need to kind of investigate that and make sure that you are aware of what it is that you're really dealing with. And when you do have any external trauma, any kind of laceration or abrasion or puncture, we need to treat that with a moist, sterile compress. And we don't ever, when we're talking about female genitalia, we don't ever pack the vaginal canal with anything. We're not going to put anything in there to stop any bleeding unless we can see that there's some kind of laceration or trauma there. We may externally apply dressings and apply pressure there to stop bleeding. So another thing that we need to talk about quickly is sexual assault. And I've kind of been alluding to that a little bit while we've been talking about this patient assessment. But sexual assault and rape are unfortunately quite common, and we as EMS providers deal with that on a pretty regular basis. So it can be very difficult for us as pre-hospital professionals to walk into a situation and deal with not only the physical aspects and the safety aspects, but also the emotional trauma that can be surrounding an assault or a rape. So just be aware that you may be uncomfortable, okay? And you need to be prepared for that. We are there protecting ourselves and our partners, making sure that the scene is safe for us to enter. And then we are also there as an advocate for that patient. You are an advocate for them, and you need to be very careful in the way that you talk with them. Make sure that they understand and know that you are there to help them, that you're there to speak up for them, that you're there to protect them, and that they're safe with you. And you need to be kind and just be aware of your mannerisms and your body language and the way that you talk to your patient, the way that you look at your patient. Be aware of how you are interacting with them and how other people on the scene are also interacting with them. We want to be sensitive and not flippant at all with the way that we deal with these patients. We also want to pay attention to how our patient is responding. Are we suspecting at all that there's any kind of intoxication going on there, either through alcohol or drug use, whether that was intentional or unintentional from the patient? And then, of course, when we do our documentation, we're going to document everything that we find, everything that we see, everything that we hear. Make sure that you document everything. And if it's possible, this is kind of an interesting thing for me to talk about. If it's possible, you want to have the same sex EMT treat the patient if that's what they're comfortable with. And and a lot of times, like when you read your book, it will tell you try to offer a female EMT to take care of the female patient. Well, guess what? Not all sexual assault and rape victims are females, and not all female sexual assault and rape victims are assaulted by a male. This goes either way here. So try to allow your patient to be treated by somebody that they are comfortable with. If there is a female and she were assaulted by a male, she may be very uncomfortable being surrounded by male EMTs or paramedics, and this is, generally this is a male dominated industry here. And so do your best to get the person that patient is comfortable with. So whether that's male or female, try to get the one that they feel the best with, or that they're connecting with the best in there to take care of them. And be willing to step back if you are the patient person and they just are not really comfortable with you, but they seem to be connecting well with your partner. Don't take it personal. Just allow the person that they're going to be able to talk to and trust be the person that they need to talk to. Okay. Uh, and your focus really needs to be on treating the patient and protecting them and being their advocate. You also need to be aware of their psychological state of mind, and they may be very upset, they may be quiet, they may be withdrawn, they may be crying, they may be yelling. Remember, go back to the 5 stages of grief, and they may be bouncing around those different stages, and you just never really know how people are going to act. So kind of be prepared for just about anything, and just be willing to be supportive of that patient, and even be supportive of other people at the scene. If there are children on scene, if there are any other people there, you may have more than one patient that you're taking care of. So remember that, and just be aware of everybody there. You need to preserve evidence, and this can be tricky. This can be very uncomfortable, for your patient, even for you. But some of the things that you need to do are, preserve the evidence. We're going to talk about how to do that. And you also need to take a history of specifically what happened. And sometimes your patients will not want to talk to you, and sometimes they'll want to tell you every little detail. Uh, so just make sure that you document everything that they tell you, and go ahead and ask the questions. Just be careful in the way that you say things, but don't be afraid to come out and ask the hard questions. Um, make sure that you document everything objectively, and anytime that there is an assault of any kind, it's a crime scene, and so we need to preserve all of that evidence. And some of the ways that we do that are we make sure that we always have gloves. We don't move anything that we don't absolutely have to move, unless it's to get to our patient and to take care of the patient. Then obviously patient care trumps evidence, right? But even while we are taking care of the patient, we want to try and make sure that we are protecting everything that we possibly can. Um, we're not going to well, we will discourage our patient from taking a shower, from using the bathroom, from changing their clothes. We want them to stay in the same clothing. We don't want them to use the bathroom unless they are insisting that they do that. And then you have to actually collect that evidence. We don't want them to flush any kind of evidence. So you have to collect that and take that with you. Uh, and if there is any clothing that the patient has already removed, or they're removing while you get there, you need to put that into a paper bag. That's the best way to not destroy or damage any forensic evidence. And we're going to label that, and uh, and keep that intact for law enforcement. If it's possible, and depending on where you live, if it's possible to go to a hospital that specializes in sexual crimes, or they have a sexual assault nursing staff that's available, to take care of the patient, that's where you want to try to transport your patient to. And so that's about it. As far as doing a patient assessment, the big things I want you to remember are just be aware of your words and the mannerisms that you use towards your patient. Make sure that you are safe, make sure that your patient is safe, make sure that you control bleeding and that you are offering assistance, and if it seems that your patient is showing any signs or symptoms of shock, you want to be aggressive with your treatment. Don't be afraid to withhold oxygen if that's what your patient needs. Treat them for shock, lay them down, cover them up, transport. They're high priority. And yeah, that's about it. So take care. Have fun doing your assignments. Talk to you later.